Hello, we are Let's Talk Bio podcast.
We would like to start by thanking you for making the time to talk to us.
So can you please introduce yourself to us?
Hello, I am pharmacist Iman Bukhamsin with a bachelor degree of pharmacology from King Saud University, 13 years experience in Dammam Irada Mental Health Complex, supervisor of outpatient pharmacy department. And thank you for hosting me.
Welcome, we are excited to start this interview. During this interview, we will ask you a few questions about antibiotics and antibiotic resistance.
Before we start, do you have anything you would like to say?
Thank you for choosing this important topic because we want to raise the awareness in the community about the overuse of antibiotics.
Okay, let's start. To begin with, can we get a simple and basic definition of antibiotics and antibiotic resistance?
Antibiotic is a drug of chemical substance that used to treat infection caused by bacteria or other microorganism. But antibiotic resistance, this is happen when bacteria and microorganisms not respond to the drug designed to kill them and continue to grow because, of course, of overuse of antibiotics.
Is antibiotic resistance that big of an issue and why?
Yes, because the resistance of antibiotic lead to failure of a treatment, which is increase the patient hospitalization, and this is lead to increase the mortality.
How does antibiotic resistance occur? Is there only one mechanism of antibiotic resistance?
Actually, there are 5 mechanisms of antibiotic against bacterial cell. First, inhibition of cell wall synthesis. Second, inhibitions of protein synthesis. Also, inhibitions of nucleic acid synthesis and alteration of cell membranes. Also, it has anti-metabolite activity.
How do infections occur by bacteria?
An infection occurs when bacteria enter the body through airway or water, food, or skin. This is also, it will be increasing and cause a reaction of our body.
I always heard that following a doctor's prescription is important. Why is that?
In the present day, we cannot get any antibiotic without doctor prescription because 90% of this infection caused by viral. So first you have to diagnose by doctor. Then he will decide if it's bacterial or viral infection. If it's caused by bacteria, we can dispensing antibiotic. However, in case of viral infection, we don't need to prescribe antibiotics.
What would happen if antibiotics were used for viral infections? Would it infect the organism being treated and how?
The antibiotic will attack normal bacteria. This is leading to antibiotic resistance. So again, we don't need to use antibiotic for viral infection.
When we get infected by bacteria and start a course of antibiotics, how can the antibiotics affect the bacterial cell but not our cells?
Antibiotics work by interfering the bacterial cell wall to prevent growth, but a human cell don't have cell walls. So antibiotic will affect only bacterial cell.
How does the healthcare provider determine if the bacteria infecting the organism is resistant?
By sending blood containing the bacteria to microbiology lab to do sensitivity resistance test.
When we take antibiotics, can antibiotics distinguish between good and bad bacteria?
Actually, no. The antibiotic will gonna to kill all bacteria. So usually we advise the patient to get probiotic from the pharmacy, or we can get it from yogurt. But we have to separate between antibiotic and yogurt around 2 hours.
Why is that?
لأن لو أنا أخذت الأنتيبيوتيك وخدت
لا شو اسمه؟
لو أنا أخذت الأنتيبيوتيك وخدت معاه اليوغرت على طول ما بستفيد، بيقوم بيقتل نفس الشيء البكتيريا النافعة الموجودة في الروبة. فأنا أعوض، أقوم أفصل ساعتين، بعدين أخذ خلاص اللي هو مفعولة خلاص ما يقدر يقتلها. عرفتي؟
فالشخص يستفيد من
إنه
الأشياء
هو يقوم
المفيدة اللي في
في الروبة اللي هو يسمونها بروبايوتيك.
Hello, we are Let's Talk Bio podcast. We would like to start by thanking you for making the time to talk to us. So can you please introduce yourself?
Hello, I am Urjuwan Al-Isa, a rare disease medical science liaison at Sanofi Specialty Care, experienced in toxicology as specialty in poison information with the Ministry of Health, worked as an accountant lead in oncology and hematology with past experience in medical affairs, a graduate from Prince Noura University with a Doctor of Pharmacy degree.
Welcome, we are excited to start this interview. During this interview, we will ask you a few questions about antibiotics and antibiotic resistance. Before we start, do you have anything you would like to say?
Thank you for having me as your guest speaker, and I hope I'll be able to answer all your doubts.
Okay, let's start. When antibiotics are given to a patient, is there only one antibiotic mechanism of action?
No, there is a different mechanism of action of antibiotic. Antibiotics works by blocking vital processes in bacteria. They kill the bacteria or stop it from spreading. This helps the body's natural immune system to fight the infection.
Is there only one type of antibiotics?
No, there are many types of antibiotics. Some antibiotics affect a wide range of bacteria. They are called broad-spectrum antibiotics, as amoxicillin and gentamicin. Some antibiotics affect only a few types of bacteria. They are narrow-spectrum antibiotics, as penicillin.
Do antibiotics work against the same type of bacteria and in the same way?
No, antibiotics works against different types of bacteria. Not all of them work in the same way. For instance, penicillin destroys bacterial cell walls. Other antibiotics can affect the way the cell works.
What makes an antibiotic work?
Something called the active ingredient, which is the chemical part in a medicine that makes it work. Antibiotics may have one or more active ingredients. They can come in one or more brand names.
Me as a patient, how am I supposed to know what is the active ingredient and the brand name of an antibiotic?
The label should tell you the active ingredient and the brand name.
How does antibiotic resistance going to affect us, and how do you know the antibiotic is working or not?
Antibiotic resistance happens when bacteria change to protect themselves from an antibiotic. Bacteria become resistant when their genes change or mutate after being in contact with an antibiotic. These changes allow the bacteria to survive or resist the antibiotic. The antibiotic no longer works to kill the bacteria or stop them from spreading. It became resistant to the bacteria itself. And you can see it and know it when the patient is not improving or the infection getting worse. And you can see it when you are doing the lab testing where white blood cells should be decreasing, sudden how it is increasing when the patient had an infection. Bacteria can also develop antibiotic resistance through contact with other bacteria. Resistant bacteria can pass their gene to other bacteria, forming a new antibiotic resistant strain of the bacteria. The more people use antibiotics, the more changed bacteria have to become resistant to them. The World Health Organization, which is the WHO, has issued a warning. They say that antibiotic resistance is one of the greatest threats to global public health today. Also, you need to be familiar with superbugs terminology.
So, what are superbugs?
Superbugs are bacteria that are resistant to many types of antibiotics. These bacteria are now very hard to treat because of antibiotic resistance. It's severe, deathful ones, as methicillin resistance. Staphylococcus aureus bacteria, which is golden staph, is a common in hospital. The bacteria that cause tuberculosis, Mycobacterium tuberculosis strains of Escherichia coli, also known as E. coli, the bacteria that cause many urinary tract infections.
Why do we need a prescription, and why do we need to contact a physician while using the antibiotics?
Bacteria are smart. They evolve in order to survive the future antibiotic attack. The more often an antibiotic is used, the more bacteria develop antibiotic resistance, rendering the drug less effective, and that's why it needs to be prescribed to decrease this issue. In addition, to get the right treatment and to make sure it's related to bacterial infection, not viral, because antibiotics won't cure the viral infection, but it will attack bacteria that weren't causing you a harm, the good bacteria, which is needed in some human parts, especially in gastrointestinal tract.
How do bacteria cause infection in our body?
Bacteria must enter your body for them to cause you an infection. So you can get a bacterial infection through an opening in your skin, such as a cut, a bug bite, or a surgical wound. Bacteria can also enter your body through your airway and cause infections like bacterial pneumonia. Common source of infection: airborne, bloodborne, sexually transmitted, fecal, oral, environmental, stagnant water, warm water system, animals.
What is the difference between bacterial infections and viral infections?
Bacterial infections are caused by bacteria. On the other hand, viral infections caused by viruses. Antibiotics are used to treat bacterial infection.
So, which illnesses are bacterial and which are viral?
Examples for bacterial infections: strep throat, pneumonia, urinary tract infections, skin infections, and for viral infections: cold, flu, bronchitis, mouse coughs, and mouse sore throats.
How do antibiotics affect the bacterial cell but not our cells?
Antibiotics must selectively target bacteria for eradication and not the cell of its human host. Antibiotics act with a process that are unique to bacteria, such as synthesis of the cell wall or folic acid, or on bacterium-specific targets within processes that are common to both bacterium and human cells, including protein or DNA replication. To understand it, for example, most bacteria produce a cell wall that is composed partially of macromolecule called peptidoglycan, itself made up of amino sugars and short peptides. Human cells do not make or need peptidoglycan. Penicillin, one of the first antibiotics to be used widely, prevents the final cross-linking steps or transpeptidation and assembly of this macromolecule. The result is a very fragile cell wall that bursts, killing the bacterium. No harm comes to the human host because penicillin doesn't inhibit any biochemical process that goes on within us.
Does hand sanitizer impact antimicrobial resistance?
This question needs more and more trials to answer it. Before pandemic, hand sanitizer is specifically needed in hospital or when being in contact with patients, germs, and bacteria. But after the pandemic, hand sanitizer is used a lot. But the one used in the community is totally different than the one used in hospital. Hand sanitizer associated resistance is another area of concern. Hand sanitizers may need to be used in combination with other procedures and should always be used appropriately. One way to prevent bacteria from becoming resistant is to make sure people clean their hands for a full 20 to 30 seconds. Bacteria can also develop resistance to certain cleaning chemicals if they are repeatedly exposed to a lower concentration or if it's used infrequent. Diluting the chemical or irregular use can provide a survival advantage to the most resistant strain, which ultimately leads to an increase in the overall resistance of the microbial population. We need lots of study to understand it and approve it or deny it.
Can bacterial infections be killed? And what is the recommended duration of antibiotic courses?
Most bacterial infections can be effectively treated with antibiotics. They either kill the bacteria or stop them from multiplying. This helps the body immune system to fight the bacteria. A typical antibiotic course is 5 days long, and usually the infection subsides completely by the end of those 5 days. However, if the infection is severe, the course may be 10 days, thereby doubling the recovery period as well the duration for which the bacterial infection may last usually depends upon the type of bacteria causing it as well as the severity of the infection.
What is the expected time of duration for the symptoms to persist?
Usually, 10 to 14 days are the expected time duration for the symptoms to persist in case of bacterial infection. However, in some cases, secondary infections occur.
What are secondary infections?
Secondary infections are infections that occur during or after treatment for another infection. It may be caused by the first treatment or by change in the immune system. Example: pneumonia caused by bacteria or fungi after having an upper respiratory infection, like cold, that was caused by virus. Some of these secondary infections may take even more than 10 to 14 days.
Thank you for letting us have the opportunity to interview you and ask you a couple of questions. It was a pleasure having you as a guest speaker on our podcast. And for the viewers, thank you so much for listening. And we hope you learned new information on antibiotic resistance with us. Thank you for watching.